My name is Yolani Tembo. I am a specialist in obstetrics and gynecology at Chipata Central Hospital. I was offered a course by Merck Foundation More Than Mother Movement in 2020, which was a one-year course in Postgraduate Diploma in Sexual and Reproductive Health. I have to confess that it has really been of help both to me and my professional, as well as the community at large. Before I did the course, I had challenges with how to handle patients that used to come with infertility. In most of the cases, I used to refer them to my colleagues. Unfortunately, even my colleagues had challenges with cases has to do with infertility. But as of now, I can say things are way much better. We have even managed to open a fertility clinic, which I'm currently heading, and we've seen quite a number of patients that have benefited. At least I can testify, I have at least 3 from the time I completed. I had 3 who successfully delivered health babies, one after about 15 years of infertility, and 2 of them that about 4 to 5 years of fertility. I have started a fertility clinic, which runs every Tuesday from morning up to around 14 hours. During that particular time, I take opportunity to educate my interns. So whenever I'm doing the clinic, I have at least 1 or 2 interns whom I try to offer some knowledge on how to handle infertility, so to speak. That's one of the things that has happened. The first thing that has happened at this hospital from the time it was set up. I think this is the first time we are having a fertility clinic, which I am heading using the knowledge that I gained from the school. And I have seen tremendous improvement in the way we handle our fertility patients. And the other thing that we are able also to do is I've tried by all means to engage my junior doctors. Every Tuesdays when I'm seeing patients, I try to involve them. So when we normally see patients together during the same time, I try to offer some knowledge, technical support to ensure that in the times where maybe I'm not around, the clinic can still run. Generally, Chipata district handles it being a central hospital in Eastern Province. It handles the referrals from about 9 districts. And in all these 9 districts, we don't have people that are able to handle fertility. And they refer patients to our institution. And in the past, we used to have challenges because even ourselves, we were not able to handle such cases. And we used to refer them, others to Lusaka, which is a bit far, more than 500 kilometers, and it's quite expensive for most patients. So majority of patients would not go, would just go home, and sometimes maybe they go and do some herbal medications, which never helped them. But with the course that I did, I can testify that if we have to refer a case to maybe say Lusaka, cases that maybe those are cases maybe that have to do with maybe IVF, like things that we are not able to do because we lack 1 or 2 things. But when it comes to expertise, I think we are able to do that, and at least the community is benefiting. Not only our community, like I said, even from other districts who are referring patients to us, they are able to testify that they are benefiting. Personally, my next step is to upgrade. I want first to do because the one I did was just a postgraduate diploma. I want to go a step further to do masters, preferable if I can have sponsorship next year. That would be my next step. When it comes to the hospital, the plan still remains the same. We have set up a fertility clinic. The challenge is that it's not enough in terms of manpower, because most cases are falling on me. Though I'm trying to orient so many doctors so that at least we can all be up to speed. I'm sure a few of them are up to speed, but still challenging, because even when I'm not around, in most cases, they have to consult me on how to go about it. I still feel if majority can be trained, then the burden can be eased. I'm really encouraging a lot of my friends. Right now, as I'm talking, I think there are quite a number, about 3 or 4 that want to start the same course. They have seen the benefits. There's nothing more fulfilling than seeing a woman who has never conceiving and going back home smiling with a baby. Is more satisfying. Personally, I think I'm really, really very grateful to Merck Foundation for giving me the opportunity to train. Though it was challenging when it has to do with time, but the knowledge that I got is really, really of benefit, mostly to my patients, and that is making me very happy.